Welcome to the Women's Basketball Series with Banner Sports Medicine. Today I'm joined by Dr. Amy Overlin. She's the Director of Women's Primary Care Sports Medicine at Banner Health and the head team physician for the Phoenix Mercury. Thank you so much for talking to me today.
Yeah, I'm excited to be here.
We're excited to have you, and let's get into it. I think it's so fascinating, and obviously women's bodies are different than men's bodies, but you treat them all the time. So let's talk about some common deficiencies that you treat in women's bodies.
Sure. So especially when it comes to athletes, one of the biggest differences we see is a higher rate of iron deficiency anemia. And iron is the main building block of our red blood cells, and our red blood cells are what picks up our oxygen and delivers it to our working muscles. And so when we have an iron deficiency anemia, we don't have as much iron or red blood cells to get that oxygen to our muscles. And so our athletes will feel more fatigued. Their muscles might cramp when they work out, and they have a longer recovery time before they can work out the next time and feel good.
And so what is the solution for an athlete that comes to you and says that they're experiencing that?
Yeah, so typically we start with food first, and so we work on foods that are rich in iron, which are often our red meats, but also green leafy vegetables. Or if they really struggle with getting it in, then we'll use a multivitamin with iron or a daily iron supplement.
Okay, and so it affects them in the moment, in their performance, but it also affects them long term as well, right?
Yeah, well, from an iron deficiency standpoint, if you correct it, they'll do great. But there are some other deficiencies that can affect our athletes long term, and that's most common with vitamin D and calcium. So vitamin D and calcium are our main building blocks for our bones. And when we don't get enough, when we go and exercise, we get microfractures in our bones. And over time, if it's not corrected, they'll develop stress fractures. And vitamin D and calcium are the bricks and mortars of our bones. So if we don't have enough calcium and vitamin D, we go exercise, we get these little microfractures, and then nothing to build them back up. So over time, stress fractures, and then they miss time playing. So the calcium and vitamin D then needs to be incorporated into foods and diet so that we can build strong bones when they're younger, but also for the rest of their lives.
Great advice for athletes and also just for all women, it sounds
Absolutely.
like too. Okay, so what about hormonal differences? So how do women's hormones come into play? How do athletes deal with their hormones changing at times?
Yeah, so the biggest thing that we focus on in women athletics is, do we have enough estrogen for our body to function normally? And for better or for worse, women get monthly periods, so we know if you have enough estrogen, you will get your period about every 30 days. When your periods stop, that is your body signaling you that you do not have enough estrogen to function normally. And estrogen is what allows our bones to get stronger over time. And so that's a really nice outward signal for us to realize, oh no, there's something wrong with our hormones. When that happens, we track it back to how much food are we eating? If we're not getting enough daily intake in our calories, the first thing that shuts off is our normal hormonal function. So the estrogen will drop, we'll stop getting periods.
So it might seem exciting or something you're like, yes, I don't have to deal
Exactly.
with this, but it does have real implications. And if you're an athlete on any level, professional athlete or somebody who just casually works out, that's definitely something you would want to address.
Yes, and 20 years ago, people used to say, work out until you don't get your period, and that's a sign of peak performance. But we've actually found out the reverse is true, and over time, these athletes actually perform at a lower level. So it might take them a month, it might take them 6 months, but down the road, they're not going to be as good of an athlete as if they are with normal hormonal function, normal periods, good nutrition.
Well, this has been some insightful information. Thank you for a great conversation today.
Absolutely.
Dr. Amy Overlin, thanks for your time, and thank you for watching the series. We'll see you next time.